Let's go across now to Dr. Abhay Sohi, CMD at Max Healthcare. He's now with us. Sir, EBITDA per bed has improved sequentially. Bed occupancy levels were stable. What were the factors at play?
So typically the second quarter has higher occupancy than the third quarter. You're aware that the third quarter typically is a seasonally weak quarter because you have Christmas, New Year's, etc. In it as well, and the month of Diwali. The second quarter has higher occupancy owing to dengue, other seasonal virals, and so on and so forth. So you saw that come down like it does, every third quarter, every year. But yet, in spite of that, we've overcompensated because of the surgeries, etc., coming back, higher clinical mix, more international patients, etc. And, as a result of which, we've actually declared the best ever EBITDA results yet again.
Good afternoon, Dr. Soy. This is Cheryl also joining in the conversation. If you could tell us how was the growth in the international business in the quarter gone by, and also if you could tell us how do you see the growth panning out in the coming quarters, especially that what I'm talking about is your international business.
So we are extremely positive and optimistic about this business. Q3 again typically is a seasonally weak quarter because at least most of the Catholic countries, people, as you would appreciate, during the months of Christmas, people are with their families, and it's like Diwali for us. They put off their surgeries and so on. Yet we are back to 110% of pre-COVID levels. So we are seeing this is in spite of the fact that Afghanistan, which has been traditionally about 12% of our revenues have come from that market, is down to zero because, right now, because of geopolitical reasons, the Indian government isn't issuing any visas. In spite of that, we are at about 110% of pre-COVID levels.
Construction of 100 beds in Shalimar Bagh and 300 in Dwarka, are they on track?
No, absolutely. So we should be opening the 100 beds in Shalimar Bagh within this quarter itself. Very early on in H2 next year, we are on schedule to open Dwarka. We already commenced the fit outs over there. So there's no reason for us to have any sort of or anticipate any delays in either one of these two projects.
Right. So in follow-up to that, Dr. Soy, we spoke about the new beds in Shalimar Bagh as well as Dwarka. So as and when these beds come in, will there be any margin dilution?
Well, not really, because Shalimar Bagh is a brownfield. We're really catering to the unsatiated demand at our own doorstep. Again, the operating leverage from these beds are significantly more than our existing beds as well. Primarily due to the fact that they have a lot of operating leverage. The management cost, the senior clinician cost, etc., is already incurred by the existing hospitals over there. Again, Dwarka, maybe, in the H2 next year. Again, it's about 300 beds on a very large base at that stage of about 3,500 beds. So we are not seeing any suppression really of EBITDA or any pressures on we are not anticipating any of those.
Thanks so much, sir, for taking out time for us.